every word sent down from heaven has the power of Christ. When you feel like you're alone and the light is wandering off, just a whisper through the gloom, you will find your compass pointing home. I am with you.
Hi my people. So how are things going in surgery? Things are hectic. Okay, things are actually hectic. So I got in and I'm with the general surgery, at least for this week, till I can figure myself out and my consultant can have time to share my time here in surgery. So it's like, first off, we had a mastectomy, and that was me just that was me just literally coming in during the mastectomy, observed. Guys, there's only so much I can actually share with you guys, because patient confidentiality, again, this is a very hands-on place. My two hands are literally in gloves. Well, it is what it is. So we had that, and I think that surgery lasted from 10:55 to about 2:30, almost 2:30. Okay, so because it was a double-sided kind of thing, partial, I would say. So, but yeah, I'm not about to go into all of those details. I just want to say that, first off, I'm realizing that surgery takes a lot of teamwork, a lot of manpower, effort, and just watching people that are skilled do what they do is just mad. It's mind-blowing, okay? I'm not even joking. Watching anesthetists be excellent at taking care of patients, making them comfortable, controlling their blood pressure, temperature, little things like that. Guys, it's marvelous to watch, not a joke. Back to me being an observer here, my experience is I've learned my experience on the first day of being in surgery, because I feel I will keep on having a lot of experience. I want to share that with you guys, and yeah, that's what is happening. So I've learned that you have to learn to get out of the way. If you're not assisting, just step back and watch or something like that. But yeah, guys, we have another surgery, and that one is actually a double-sided, bilateral mastectomy, and this is going to take some more time. I don't know how many hours this is going to take. I hope I have this time enough for it, because only this one that I got tired at some point. I had to sit down, take a walk. I have some sweets in my pockets because I'm trying not to be too careful, okay? I'm trying to make sure I have all my bases covered. But yeah, that is what is happening. What else is going on? Yeah, got my scrubs. Apparently, if you're working in surgery, you get some scrubs and whatnot. It's a whole shebang, okay? It's a whole shebang. Now that I've had some food, people who work in theater get food after the surgery. So now that I have, I'm just going to rest. Hi guys, today has been quite a day, okay? So first off, please, if you haven't subscribed, if you haven't thumbs up to this video and you're enjoying it, please support this channel by giving this video a thumbs up. Subscribe if you're new, if you want more of this type of content. Thank you so very much. So how has today been going? Today has been eventful, guys. First off, I thought we were going to be going into surgery, but we weren't going into surgery today. So today was breast clinic, and First, like, I don't know why I keep saying first off, but it would blow your minds to find out how many patients or how many people come down with like breast mass, breast problems, breast, abscess, things like that. So I kept on like seeing a lot of those type of patients. I was opportune to see like loads and loads of breast examinations. So that happened. We had like different patients come in at different stages of their journey. Patients who had already done their scans, who were already like diagnosed, who were coming in for treatment. We had some people in chemo. I didn't get to see those guys though, because it was just an up and about day. Okay, so clinic took, honestly, I wasn't there from the start of clinic, but from the time I was there, that's about, clinic took almost a little over 4 hours actually. So clinic lasted that long for I, who wasn't there from the start of clinic. I don't know about people who were there from the start of clinic. I don't know how long it would have lasted for them, but yeah. After that, we went to see some of our patients in the ward, some of our patients in A&E, like new patients that needed like quick procedures, samples taken from them, people who needed, I think we had a patient who needed an NG tube, so I got to see how that was passed in for gastric decompression. Also to see a urinary catheterization again. I think that was for a female patient. So I think like the learning has been happening like very spontaneously. I got to see a breast abscess drained. These are things like you only read about in books. Yes, I wasn't actively participating in patient care. I mean, I don't like have my license and whatnot, but I was able to listen, to understand my doctor's line of thought, to ask questions if I didn't get it right. Another good thing was I was able to actively participate in like the little jobs, like getting the prepping items to set lines, prepping items for the NG tube. It's been such a journey, and the funny thing is I haven't had anything to eat today apart from breakfast that I had and a bottle of malt that I haven't finished yet. And I showed you guys but how big the malt bottle is. Like, it's a really small one, but it's my bag. So yeah, that is actually what is happening. So because today we're in clinic, I ended up changing to my ward coat. I thought we were going to have a presentation today, so I was waiting outside the presentation room, but I think I got it wrong. So I think one of the first problems that you face is you don't really know anywhere, and you don't really know how things work when you change departments. So everything is just coming at you like boom boom boom, and everyone is expecting you to know. All right, so if you want this to be easy, I hope you're in an environment that's a lot more structured. Maybe they have a plan for you, a program for you, someone who would do your orientation thing for you. But if that is not exactly happening, once you get there on your first day, take everybody's contacts. Like, take as much contact as you can, emails, phone numbers, WhatsApp numbers, things you can actually reach your doctors or HOs or senior doctors on, so that they can kind of like guide you in case you have any more questions, in case you have any more things to ask about. So yeah, that's actually what is going on now, guys. The reason why I didn't vlog anymore yesterday, even like after getting off work and going home, was I was exhausted. I literally just got home and I slept like a child. Like, the way I slept, oh my god. Though I kept waking up in the middle of the night to like, I was like, what is wrong? Why am I sleeping like this? I didn't really have anything to eat, but I think that kind of comes with the journey. So yeah, if you're going through this or you plan to go on an observership program, please have this at the back of your mind. All right. So yeah, guys, I am running late. I need to head home. I need to travel back home, and that is a long time away from here. So I most likely will see you guys today when I get home, or I'll see you guys tomorrow when I come back, here, and we have a whole new thing. I already did my findings, so I know it's presentation tomorrow. I just don't know where, when, all those nitty-gritty. I think they told me, but Yeah. So I don't know all of those things, but I have taken the contacts of my senior doctors, my HOs. HOs are house officers, in case you're watching this for the first time, and house officers in Nigeria are like interns. So that's what I will be when I pass my MDCN exam and get matched into a hospital to do my internship. So yeah, guys, I feel like I've spoken a lot, so now I'm just going to take up my word coat and head home. Thank you so much for staying with me up until now. If you're enjoying this journey, okay, support your girl right in the comments section. Let me know what part of this vlogs you're enjoying, because guy, I am dealing with storage issues, time issues, trying not to reveal too much about my surroundings, patients, fellow doctors, things like that. So yeah, guys, I'm going to see you guys in a bit. Okay, bye. This is 12:14. We're taking a break. Start another presentation in 30 minutes to an hour. So we have like 30 minutes to an hour recess. So yeah, that's actually what is happening, guys. I'm going to check back in with you guys soon. I was going to share clips from the presentation, but it was just too loaded. There was too much information, and every time I picked up my phone, I was looking up something, cross-checking something. So it was like a revision class for me. The lecture was on incisional hernias management. We went through anatomy, case patients. You know what, guys? I'm going to talk to you guys properly later. Okay, take care of yourself. We're done with the. I'm a YouTuber, so do you want to be on my YouTube channel?
Who's there? Who are you communicating to?
You'll see them on the online. Anyways, so I'm with my chief right now. And
yes, we are together.
Yeah, so I'm with my chief right now.
Yes, we are going to A&E to see a patient.
Oh my god, you guys. Hi, my people. Good afternoon, I think. Okay. Good afternoon. So let me bring you up to speed with what has been happening. Okay, so first off, we had a presentation today, an extensive presentation, if I must say so myself, an extensive presentation on hernias, anatomy. We had a case. So for example, Mr. So coming in with this type of hernia. We're majorly dealing with incisional hernias, ways to manage, ways to prevent reoccurring incisional hernias, things like that. There's a question session for every presentator, if that's a word. Okay, so we had that done. That took us about 2 hours, a little over 2 hours actually, because it was like first HO presents. He presents the case, takes question and answers. The next HO presents, she presented on the anatomy, took question and answers, and then the registrar came to present management modalities, best options for management, things like that. We also had like consultants chip in, from time to time, just to aid the learning process. I'm sorry guys that I look like spread. Life is happening to me, alright? So after that we had another presentation on electrolyte and fluid management in surgical patients. So we're dealing with things like your sodiums, potassiums, chlorides, basically how they get filtered out, dehydration management modalities, mild, moderate, severe dehydration management levels, things like that. And yeah, that actually, like, that was honestly, I feel like by the second presentation I was already a little out of it, like I was already a little tired. but thankfully we got some refreshments. I already showed you guys that earlier. So but yeah, after that presentation, yeah, we had a brief recess, and then we went to the ward. We had a patient on the ward that was for trauma and orthopedics. So it was like a simulation presentation. So that's the third presentation we had today. Simulation presentation where you come in, listen to the case presented by whichever doctor is handling or managing the patient, how far they're bringing us up onto speed. I also haven't had anything to eat since I've been in the hospital, but thankfully I had breakfast, so I think we're getting better at this doctor thing. I honestly think we're getting better at this doctor thing.
Five. Are you ready? Yes. I'm going to over 209. Nothing.
Dr. Santos, say hi.
Hello.
Hi. From the channel. No, you can show. I'm so sorry. I feel like I should be pumped and all of that, but I really am not feeling it today. I'm kind of out of it, and I feel like I need extra motivation. I feel like I feel tired from inside. I don't know if that's making sense. Hi guys, I know that I look like a mess at this point, but please bear with me, okay? So how has surgery been going? I know I haven't been checking in with you guys like every day like I did with my medical postings, most especially endocrinology, but what has been happening for me, I didn't get the grace to shuttle sub departments here. I mean, there are different sub departments here in surgery, but I just stayed in general surgery, and I'm kind of grateful because first off, it saved me some stress, and I still got to learn a thing or two from the other subdivisions, and I'll explain why soon. Okay, so here there's like cardiothoracic surgery, orthopedic surgery, ophthalmic surgery, general surgery, urology, pediatric surgery, neurosurgery. I mean, there's a lot of surgical units. So when I came in, I spoke to the head officer at that time. I think they call them head of departments, I'm not very sure right now. And he assigned me to start with general surgery. So it was like, okay, just stay in general surgery and let's see how things go from there. And I spent my whole time in general surgery. Now, while I've spent my whole time in general surgery, we usually have things like, we usually have academic days. So academic days are usually Wednesdays, and on Wednesdays, like a typical Wednesday is after the rounds and everything, house officer rounds, registrar senior reg rounds, consultant rounds, if they down for that kind of thing before the main seminars. We have a lot of seminars, like a lot of presentation across the different branches of surgery, and that's one of the things that I really appreciated. I think for me, that's one of the things that I enjoyed the most here. Yes, the ward rounds are like not as bulky, if I may use that word, as medicine ward rounds. I mean, they're more hands-on here. The department itself is more direct. It is surgery. If it's not there, it's not there. We are not cutting whatever open. If it's there, it's there. We're cutting it open, we're taking it out, and we're closing you back up. Okay, so it was really very direct for me. Another opportunity that I got to enjoy here, I made a lot of senior doctor friends, and they've kind of put me through with high yield topics, with high yield topics that are relevant to their department. And a very good example of this is from cardiothoracic surgery unit. One of the things that I'm really grateful for, I'm so sorry for all the background noise, guys, but yeah, it is what it is. So one of the things that I got to enjoy, with cardiothoracic surgery units, I got to watch chest intubations, and just see the process. So now it's more, when I go and explain, if I get asked this question in an exam or something like that, I'm going to be explaining from the point of, I have seen this before, I have experienced this before, and whether or not I revise this 1 million, 10 million times, I am still going to know this thing well. Okay, another branch was orthopedic surgery, and it was shocking because I already have some history with orthopedic surgery. If you already watched my medical electives, my electives in North Middlesex University Hospital, you already know how ortho and I have been getting along. So yeah, I would just say that for fractures, types of fractures, external, internal fixators, open reductions, different things like that, I got to revise them, hear them, know risks, those type of things, risk assessments, triage, watch doctors practice triage on the spot, in 3 seconds, 5 seconds, people are doing these things, and then I've already watched it before I realized just what they've done. I don't know if that makes sense, but yeah, that's some of the things that I've been seeing as well. Also, I noticed it got really hard to vlog, plus I'm really trying to protect the identity of my patients, so that is, we'll see. If I'm able to share, I'll share. Whatever I'm permitted or allowed to share, I will. If not, it's alright, guys. I love you guys still. Also, another thing that I've got the opportunity to do, my time in general surgery, my senior doctor took it upon herself to make sure that every single time she saw me, I was practicing something. She'd just go hey, any cleric anterior neck swelling, cleric, we've seen a lot of mastectomies now, cleric mastectomy, okay, perform a breast examination. These are things that I know the theory, but I haven't really done a lot of practicing since the last time that I practiced clerking for some of these things. But yeah, that's by the way. Also, being in general surgery has kind of really made me check in with myself if I really like surgery, if I really want to dive into surgery, which parts of surgery I think I like, all those kind of questions, because I'm finding out that surgery is just not the surgeon. Surgery is teamwork, everybody is together, okay? And I still love surgery, okay? I still love surgery, guys, and I'm sharing all these experiences with you guys because today is my last day in surgery. All right, another thing I noticed is breast lumps, breast cancers, things like that are more common than I thought they actually were. So please, if you're a lady, you're watching this, you haven't done a breast exam on yourself, you don't know how to self-examine your bones, please pause this video, check yourself, or if you're alone, you can just, whenever you have the time, please, all right? Okay, so now that I've done that sensitization and I've just shared my experience with you guys in this is 3 weeks in 3 minutes, or 3 weeks in 9 minutes. I don't even know how long this clip is going to play for, but yeah, I love you guys so much. I'm glad that you're coming on this journey with me. I'm glad that I'm able to share this, to document this, to have built some resilience at this point, because I think if I started with surgery, I would have suffered more than I did. If you haven't watched my medical posting in endocrinology, neuronephrocardiocardio, please check it out. I'm editing those videos now, and I'm just seeing how fatigued I was, and I'm realizing how much strength I would need when I start my house job, and guys, it's immense. most of the things I'm saying, I know people believe that it won't help you with your exam, but I'm just going to go through this whole process, and then when I'm done, I will share the experience, the pros and cons with you guys, so that we can objectively analyze it. Okay, I don't say anything now because I may speak from a place of excitement, because I'm learning new things, making new friends, new connections, I'm in new environments, and I'm building stamina, and I'm adding to my resume in the process, because I'm always going to have done a placement, 2 placements, 3 placements. So I'm going to cut all this part out. If I don't cut it, I'm just encouraging you guys to add value to yourself. If you're a medical student, you're watching this, think of ways that you can empower yourself. Ayana, shall I come and say hello? Oh, hi. Okay, so if you're a medical student, you are watching this, you're a medical graduate, I don't know, even if you're higher up along the medical line, I don't know, let this just be some form of encouragement for you. Please keep on going. You are not alone, you got this, and you totally rock. Okay, so with this, I'm gonna leave you guys with peace and lots of love.